The knee is one of the most complex joints in the human body. Bones, ligaments, cartilage, and meniscus work together as a unit with very specific tasks. Stabilization, shock absorbing, load distribution are just a few of these highly specific features these structures offer. If, for example, through trauma or overload, one or more parts of the knee are damaged, the whole function of the knee is compromised. It is the task of the sports surgeon to treat the injury and reinstall the function of the knee as best as possible. Appropriate surgical procedures, followed by a comprehensive rehabilitation program, give the patients the best chances to regain the full functionality. Professional athletes active, especially in contact or other high-impact sports, are exposed to a higher risk to damage the knee joint frequently. Olga Sazhina is a 24-year-old professional volleyball player. As a member of the Volero team in Zurich, she plays at the highest possible level, the Champions League. In volleyball specifically, knee injuries are very common due to extremely high peak load combined with rotating during jumping and landing.
I was 8 years old when I started to play volleyball in my hometown, Ijevsk in Russia. It was always volleyball. It's my passion since I was a kid. It was 17 years old when I have got my first contract in MGFSO team in Moscow. In 2007, after I played volleyball in Super League for 5 years, I started to feel some pain, especially during the landing or after block defense or smash. And at the beginning, some medication is helped, but over the time I feel more pain. In 2009 I had my first surgery where part of my left lateral meniscus were removed and the cartilage was debrided. After the operation I did recover well and I came back to the court after 4 weeks. Over time the pain came back and last month I only could play taking painkillers. At this point, I consulted with Dr. Lucy from Sport Clinic here in Zurich to see what the options I have.
Olga has a very typical situation. She has a high impact sport with a lot of hits and pivoting on the knee. That means her capacity of the knee will suffer many hits and the tissue inside will be damaged over the time. You had an injury where you lost your meniscus. If we watch now your knee from the front, we have here the inner, the medial side with the meniscus. On the lateral side you had the injured part and this triangular is lacking. It's void and the cartilage is destroyed. The aim for the treatment is to refill this so you have again a good shock absorbing. This is a serious injury for a high-performance athlete and she has high aims. She wants to play in London or the European Championship and that means within 1 or 2 years she should be back and we need a replacement for her shock absorbing. If we have a look in the knee, I want to replace this spacer within the femur and the tibia with a new device that is sutured in to the joint like it is shown here on the model. That is your old good meniscus and the red one is the new which needs to be sutured. This, Olga, is the situation in your knee with the damaged meniscus.
First, the damaged area of the meniscus is cut away back to the meniscus rim, where there is a blood supply. Second, the size of the area removed is estimated using a simple measuring ruler. The ActiFit implant is cut by the surgeon to fit the area. Third, the ActiFit implant is inserted into the knee, positioned where the damage was removed, and stitched to the remaining natural meniscus. The ActiFit implant, positioned in the area removed, connects to the area of meniscal blood supply so that blood can immediately flow through the ActiFit, bringing with it the body's natural healing processes. The body's own cells can then start to grow new meniscus-like tissue as the implant slowly starts to degrade.
It is a very important step since the tissue has several steps to heal. It's as important as the meniscus to have a shock absorbing. So we have strong guidelines for the athlete to go through. She needs more than just physiotherapy. After the end of this time, we have chosen the speed training to come back to her most important muscle function, speed and control.
We are using this type of exercising since 2006, which we have very well results in the spot of rehabilitation and high level performance. More athletes get injured, and with the speed training we can get the players or the athletes very quick back to the platform of the trainings. We have coordination, especially sensomotoric training and the neuronal muscle activities. We got some computers type of workouts. So like this we have always a result. We see straight the feedback of the trainings, which is giving the athletes a feedback straight after training, straight after the exercise, which is giving him also the motivation to go always to his maximum.
After 1 year you are back in the team, your knee is not painful, no swelling, and the situation in the MRI shows us that you have a nice good meniscus. It is still a little light compared to the original one, but very normal. So my guess, if you qualify in the team, you will be on the Olympics.
I feel pretty well. I have no pain. I can exercise and play as before my injury. And I hope that Dr. Luci is right and I can play to Olympic Games in London in 2012.